Welcome back to Health Law Pulse, the podcast where we explore how healthcare, leadership, and law intersect in the real world. I'm your host, Jonathan Rhodes, healthcare attorney and founder of Health Law Counsel, LLC. This podcast was never intended to be solely about healthcare compliance, risk, or about legal issues in healthcare. I love discussing and thinking about all aspects of healthcare delivery, operations, and clinical matters. Today's episode focuses on one of the most talked about and often misunderstood issues in healthcare: pricing transparency. Over the past several years, there's been a significant push to make healthcare pricing more visible to patients. But as many people have experienced firsthand, visibility doesn't always translate into clarity. Knowing the price is one thing. Understanding what you'll actually pay and how to make decisions based on that information is something else entirely. To help unpack that, I'm joined today by Adam Cunningham, CEO of Sylk Health, a company focused on helping patients navigate healthcare pricing and make more informed decisions about their care through exploring options in medical tourism. Adam brings a unique perspective to this conversation, working at the intersection of consumer experience, pricing data, and healthcare operations, areas that are becoming increasingly important as the industry moves towards a more consumer-driven model. In this episode, we talk about why pricing in healthcare remains so complex, what true transparency actually looks like, the growing trend of medical tourism, and how better information can change the way patients engage with care. This is Health Law Pulse. Welcome to another episode of Health Law Pulse. I have Adam Cunningham with me today. Adam, welcome. Thank you for carving out some time to chat with me a little bit.
G'day, Jonathan, and thank you very much.
Excellent. Adam, so I always like to start with giving you an opportunity to introduce yourself. Tell us a little bit about what you're doing right now in the healthcare space and just your experience and background. We'll go from there.
Right. Well, to put it very simply, I studied medicine, don't really practice because of my health, and decided and realized that I could better put my experience to better use, helping people actually get access to healthcare.
Yeah, perfect. Access to healthcare is an important topic in this podcast, and something we try to address and talk about quite a bit. Very important. Access is an issue in a lot of different areas throughout the world. So I just want to start there. Now you are with Sylk Health, and Sylk Health spelled SYLK, just so people can know. Find out a little bit more about your organization. Go to sylkhealth.com. Again, SYLK health.com to learn a little bit more about your organization. But you tell us a little bit about Sylk Health. What problem are you trying to solve when you started Sylk Health?
Well, there's a plethora of problems when it comes to healthcare, so I'll take one at a time. But the story is, I've got a friend in Maine, and she worked as a women's advocate up until about a year ago, and she lost her job because of the Doge cuts that Trump initiated. And just before that, she developed incredibly severe, debilitating rheumatoid arthritis, and in the time between when she developed the condition and when she lost her job and lost her health insurance, which was about 5 or 6 months, she basically just ran around in circles with her insurance company and her doctors. Her doctors certainly tried to help her, and every time they suggested something, such as a treatment or something like that, the health insurance companies would say, no, you don't need that, try this. And everything they would suggest would be a cheaper alternative, but in her case, an ineffective alternative. And so that really spurred me to look elsewhere, to look at all the options that exist and try to put my knowledge and try and towards helping her situation. And that's how Sylk Health came to be. And the way that I look at it, being that whether it's the US, whether it's Canada, Australia, whether it's India, it doesn't matter what country it is, there's far too many people that need access to healthcare that simply can't get it for whatever reason. In the US, for instance, more often than not, it's a matter of cost. In the UK, for instance, it's often a matter of waiting times. And so I was on a podcast a little while ago with I think it was Sandy Kibling, and she is a healthcare insurance broker. And for a hip replacement or a knee replacement, she ended up paying $67,000
Mm.
just to get a hip replacement. And the equivalent treatment at one of our hospitals or associated hospitals is something like $14,000 at most. And so when you compare those two prices together, you have to question if everybody knew about these prices, would anyone be paying $67,000 or $50,000 or $40,000 or even $30,000? And so I really came to understand that the vast majority of people, while they do have health conditions, very pressing and serious health conditions, simply don't know that there are other options available. And so much of our work right now is simply letting people know that you're not necessarily trapped in the healthcare system with which you reside currently,
Right.
whether it be in the US or the UK, for instance. But in fact, there are other options which can be had much cheaper and with significantly less waiting time in other countries. And so right now, we are listing Chinese healthcare as an option for many people, say in the US, who can't afford care. And the price difference is absolutely incredible. Some might even say insane. Uh, CAR T being a cancer treatment, often running four, five, $600,000 in the US, and quite often even higher. And the comparable treatment in China being closer to about $80,000 to $100,000. And it's not just the money, which quite often it is, but it's the knock-on effects of spending $500,000 or more on treatment that's quite often the problem. Some people don't pursue treatment simply because the cost is too high. Some people decide, no, I've got cancer, it's going to cost me 500,000, and you know what? That's the value of my house. So what am I going to do? Am I going to leave my kids with no house, or am I just going to suck it up and either end it all, or wait for cancer to kill me? There's other people who are going into hundreds of thousands of dollars of debt and ruining their lives. There's people who are going into hundreds of thousands, even millions of dollars of debt, and deciding that it's too much. So the statistics, any way you want to look at it, are just absolutely appalling.
Right.
And so
So
that's what we're here to help.
yeah, so very very interesting. So you did a great job outlining the problem. And so my understanding of Silk Health, then you correct me where I'm going wrong here, but so here the predominant issue here, meaning United States, you're a global organization. Here in the United States, a lot of times treatments, especially for these kind of unique disease states, maybe not so much unique, but high cost disease states, the cost is prohibitive, whether you have insurance or not. Places like the UK, cost isn't so much the issue, but it's the waiting time, particularly for necessary, but what may be determined to be elective procedures. And so you're trying to solve for those issues. And so my understanding is that so you take that information, the cost information, the wait time information, and you go out and find, and right now you're focused on those same procedures and those same treatment regimens in China, and you do a comparison just so people know that there are options out there that are less expensive, or you don't have to wait so long for their treatment or whatever procedure they may need. Is that accurate?
Mostly accurate. So,
Okay.
traditional medical tourism, plus a lot of the big providers, the way in which it works is they'll partner with a bunch of hospitals,
Mhm.
and they will then field requests from people who have some kind of condition, as opposed to displaying prices and displaying treatments and their wait times like you would on a marketplace. For instance, what they do is they have coordinators which will get in contact with a patient and then take that information and talk to three or four or five or 10 different hospitals and try and work out a treatment package and a plan. And believe it or not, employing people to do that kind of costs money and costs time. And quite often, you'll make an inquiry and you won't get a response for a week, a month, or any solid information for quite a while. And so the way we've done it is quite the opposite. We list prices from hospitals. The way it is, we have a whole bunch of partnered healthcare providers currently in China, but soon to be expanded. We have a large catalog of procedures, and not just major ones, but also minor ones as well. Basic dentistry and things like that. And they then select the procedures which they wish to offer. They put a price against them. They put a waiting time against them. And then anybody, such as yourself, such as the average person who has a toothache or something like that, they can then come to our website, look for the procedure that they want or believe they need or have been advised to get by a doctor, and then they can see all of the different healthcare providers that offer that procedure. And then from there, they can go ahead and book a consultation directly with that healthcare provider. And so the way it is, we're not trying to obfuscate, we're not trying to inject ourselves into the process and add on extra packages and fees and things like that. It's just putting solutions and people with problems together.
Yeah, that's really interesting. So you mentioned the applicable procedures that you would normally be working with here. It could be major, it could be minor. What types of procedures are you seeing that are really driving this trend? What are patients looking for, whether it's the wait times or whether it's cost prohibitive? What's really driving maybe the traffic that you're seeing in trying to get alternative healthcare?
Well, right now, we haven't started too much advertising. And so the people that find us organically, you might say, are
Mm.
quite often people who have procedures that are around $10,000 in value or more. So at least $10,000 in value in China. And so these procedures in the US, for instance, might be worth $30,000 or $40,000, or maybe $20,000, whatever it might be. So they're generally people who are going to spend, at least four figures
Mhm.
on a procedure. But we're not necessarily limited to them, and that's the thing. We've fielded quite a few inquiries for dental work and things like that, and the total cost of all their treatment for dental work might be $3,000 or $4,000 in China, but the equivalent of that back at their home may very well be either 8, 9, 10 months of waiting, or it
Right.
might very well be $20,000, $30,000 worth of dental work. So it really varies all over the place. The interesting thing about international destinations for healthcare is that even minor things, even things that you would want to do but you would put off simply because of the cost, they suddenly become accessible once they're in another country at a reasonable price. And so, people who are putting off dental work, which is a very, very common thing, all of a sudden it's available to them simply by going into China. In many cases, just hopping across the border into Mexico, for instance.
Right. Okay, very interesting. So you're not necessarily seeing a particular procedure or course of treatment that's really driving traffic. It's more, not everything fits within this bucket, but it's more high cost issues, my high cost items that is really driving, regardless of the procedure, regardless of the treatment, it's really driving the traffic here.
There's certainly a lot of high cost interest. There's a lot of people looking at cancer treatments and
Yeah.
things like that. It's a huge one, and it's unavoidable. That really is one of the biggest killers of financial stability for many people. Is, oh, I've been diagnosed with cancer. Here's $300,000 worth of medical bills, and so that's a very, very common thing for us. But I have to stress that we're not necessarily limited to it. I'm not saying that from a sales perspective. Just finding that there's so many people who have so many small, you might say, issues that don't get them fixed at home. To launch into a bit of a bit more context on that, like quite often people will say that in the US, it's not a matter of waiting time. You don't have to wait for care in the US. You can get any care that you want. You'll get the best care that you want, but you've just got to pay for it. And the reality of that is, in the US, there's about 2.3 doctors to every 1,000 people, and in the UK, for instance, it's 3.4 to every 1,000, and in Australia, it's 4.3. But we'll always hear about how the UK system is overloaded and how the Australian system is beginning to become overloaded. And the simple reason for that is that I certainly don't doubt that people in the US are having the same amount or same rate of medical issues as anybody else. And in fact, I'd wager that it's greater. And the simple reality is that there are millions of people, tens of millions of people, hundreds of millions of people perhaps, that have medical issues and simply don't get them attended to because it's going to cost a bunch of money. And so all of a sudden, that's why I say things like relatively minor dental work are now something that can be looked at simply by going across a border.
Yeah, that's very interesting, and I want to talk a little bit about medical tourism as a healthcare model. So, how should we think about medical tourism? Is it sort of a niche option, or is it a structural shift in healthcare delivery? Given in some places there's a lack of pricing transparency, and there's a lot of frustration with a number of different healthcare models. And we know that healthcare is becoming more globalized as the world gets smaller. But how do you view medical tourism in terms of a delivery model?
You know, uh, 10 years ago, that would be an up and coming question. 20 years ago, that would be an up and coming question. But we wrote a paper on this relatively recently. It's about to be published, quite talking about how medical tourism is there a financial incentive to pursue it for the average person, for the average layman. But now there is a fiduciary interest in medical tourism as well. And what I mean by that is recently there was a ruling in regards to the responsibility of self funded health insurance for employers and how they now have the responsibility to look for cheaper options, even if those cheaper options exist abroad. And the importance of that now is essentially that if you're looking at, yet again, a hip replacement in the US costing 50, 60, $70,000, and the same thing is available, say, in China for $13,000 or $14,000, you as an employer can be held liable for that. You are now suable for that. And you might say, "Oh, that's government overreach." But on the other hand, you might also say that, well, that's the free market in action to some degree or another.
Sure.
And while there has been a definite trend towards medical tourism, even in the past few years, as a matter of fact, I believe it was in 2021 or 2022, US medical tourism number, like outbound medical tourism number, was about 1.1 million. And in 2024 or 2025, it was around 1.6. So that should give you an idea of just how quickly the rate is growing.
Right.
But now that there is the involvement of employers, and about 63% of American employers do self funded healthcare insurance, all of a sudden, I think that number is going to not just double, not just triple. I think it's really going to take off. Of course, I want to say that considering this
Sure.
is my industry, but now there's very good reason for it to happen. And I don't just say very good reason from a business perspective, but very good reason from an outcomes perspective for the average person who just needs medical treatment done.
Yeah, very interesting. What do you think the biggest misconceptions are about seeking care abroad?
Well, it depends on who you ask. The sad thing is that there's a lot of Cold War mindset left over with many people, and sadly, that Cold War mindset, I would say, is most prevalent in the people who perhaps need that healthcare the most. China, uh, adversaries such as Russia and things like that, or former adversaries, you might say, they perhaps suffer in a immediate, off the top of your head kind of image or appreciation when they do provide very real, serious quality solutions to the problems that many people face. And so that is perhaps the biggest issue, you might say, for most people to get over or to understand as time goes by. And that, I would say, that applies mostly to people in their mid late 40s, certainly 50s, certainly 60s, and most definitely 70s. And I don't necessarily blame anyone like that. I'm simply saying that we're all products of the environment that we live, grew up in, and exist in. And yes, this Cold War mindset is sadly preventing a lot of people from seeking or realizing the availability of care that they need. That is probably the biggest misconception.
Yeah. So what would you say? So I'm in my late 40s. I'm in one of those buckets you just described, and w- I'm from a quality perspective. So I would think that I don't know about the UK, but in the United States, if you were to go up to someone my age, late 40s, 50s, 60s, I think that's a good age range, and said, "Hey, like I get it, you got insurance, but this is what your procedure is going to cost here. We've got this other option in China that is significantly less expensive. It's the same procedure." And the response is, "Well, yeah, I get it, but here in the US, we have the best healthcare in terms of quality in the world." And I'm a little nervous about the quality of care if I go to China. What's your response to that in terms of quality? How do you vet your hospital partners, or how do you respond to someone who has quality concerns over this type of delivery model?
Well, to be a little bit combative there, I very much could say that just because the US has the highest range, you might say, of quality care, the upper range is very good. Does that mean that you're actually going to be getting the
Totally
highest
fair. Totally
quality of
fair.
care? Certainly at the prices the layman is going to want to pay. Most certainly not.
Yep.
And so the same thing extends to China. If you go to a hospital out in the middle of nowhere in the US, you're probably not going to get the best care. If you
Right.
go out to a hospital in the middle of China, you're not going to get the best care either. And so how that applies to China is, yeah, most certainly we vet our providers quite thoroughly, but it's not like we have to put everything under a microscope because that microscope has already been applied to them. There are international bodies such as the Joint Commission International,
Mhm.
which accredits various facilities around the world, plenty of facilities in the US, for instance, and plenty of facilities in China. And so a very large portion of our providers there have that accreditation. But similarly, a lot of providers in China also hold incredibly high accreditation standards within the Chinese system.
Right.
And so there's what's called the 3A accreditation, and that is China's highest accreditation standard or government accreditation standard for a hospital. And of about 35,000 hospitals in China, only about 1,200 actually have that standard. And of course, that's a very big number, but relatively speaking, it's not.
Sure.
And out of every single healthcare provider that we currently work with in China, every single one of them holds that standard. And to draw a bit of a parallel, I think the easiest way to compare things when it comes to China and perhaps the understanding of China and Chinese quality is Japan and Japanese quality. And following World War II, Japan and its products weren't very highly regarded. Quite often you talk about our Japanese steel, it's terrible, and everything they make is terrible, and they're making cheap cars. And somehow terrible quality steel and cheap cars turned into, Toyota being the gold standard when it comes to reliability. And if you're not buying a Japanese kitchen knife, then you're not really a chef.
Right.
And, that happened over the course of about 20 years, maybe 30 years. And believe it or not, almost an identical thing is happening in China as well. It's gone from a mass produced economy to all of a sudden putting out very high end products and services. And a good example of that, sadly not very available to the US right now, would be their automotive industry.
Hmm.
Going from something that was unknown and frankly not spoken about much to basically knocking over all of the European automakers over in a few years. And while, of course, what the automotive industry isn't necessarily healthcare and medicine or anything like that, but I think you can draw a parallel by simply saying that perhaps all is not necessarily as is assumed and as history, or at least the past 20, 30 years, has implied. And when it comes to healthcare, China most certainly is leaps and bounds ahead of what the vast majority of people think. The amount of research they're pumping out every year is not just high, it's actually greater than the United States in terms of pure volume. And the quality is certainly up there with the US as well.
Right.
And there's plenty of research, plenty of trials, stem cell research, cancer research, advanced cancer treatments, all kinds of things like that coming out of China. So by no means whatsoever should it necessarily just be considered this backwater out in the middle of nowhere.
Yeah, that's a great response. So very interesting stuff. One more quality question. So just in terms of continuity, right? And of course, this will depend on the procedure or the specific treatment that a patient is receiving abroad. But let's assume it's cancer treatment.
Mm.
There are ongoing continuity of care requirements. Perhaps it's a knee replacement. Obviously, ongoing appointments or various continuity of care reviews or requirements that is going to require some provider oversight. When you receive treatment or a procedure abroad, what does continuity of care look like so that the patient comes back home, whether it's US or UK or wherever. And what does that look like? And what are the risks of that disconnect from the original provider? Or how should providers think about treating patients who receive care abroad?
Well, I'd be lying to you if I said it was just as simple as doing it back at home. Best solution would be to have all of your care at home.
Right.
However, if that were the best option, or at least financially speaking, then everyone would be doing it, but they're not. And the trend obviously is going towards international tourism.
Hmm.
When it comes to continuity of care, of course, it's not the simplest thing compared to the being in your home country. However, it doesn't mean that it doesn't work or that it's going to be overly complicated. And so, for a lot of treatments, it's quite really as simple as a letter can be provided or documentation can be provided from the healthcare provider in China. All of the details of the surgery that you've had or whatever treatment it might be can be provided. And then all of the blood results, for instance, blood tests and things like that, all of the scans that you may have had, they're also provided as well. Most often than not, or more often than not, the healthcare provider in China will translate everything back into your native language, in this case, English. But there really isn't too much of an issue in going back home. And for most doctors who might be dealing with a specialty that you're looking at, it's really just as simple as reading the papers that were provided from China or whatever country it might be.
Sure.
And I don't think it necessarily needs to be much more complicated than that. Of course, there are going to be highly complex cases,
Right.
but highly complex cases are complex regardless of where you are or how you do it. I would say that the price more than offsets a lot of the issues that you might be having,
Sure.
with documentation or something like that.
Sure. So let's talk a little bit about that. I'm very interested in the globalization of healthcare and particularly in what Silk does with respect to global healthcare competition. Are we are we moving towards a more globalized healthcare market? Just you mentioned a little bit earlier in terms of self-insured employer plans and certain fiduciary duties that they have to get the best cost plan out there, even if it's not domestic. I mean, where are we going from here? What are we looking at a real globalized healthcare market, and the world is getting so much smaller? Is that where we're headed? Where are we? I mean, we're seeing increased trends in medical tourism. So what does that mean for the globalization of healthcare?
The sad thing about healthcare, especially in the US, is that while we might claim that it's the free market, it isn't exactly the free
Right.
market, and that's one of the big impediments to people getting timely and affordable healthcare.
Or
And so I would say most certainly yes. The answer to your question is yes. It is becoming a considerably smaller world, and healthcare is becoming considerably more accessible. And I think it will become ever more accessible in leaps and bounds in the coming years. But that's not to say that everything is going to be an incredibly easy ride, at least when you want to talk from, say, a policy and politics angle. And highly politicized countries such as China most certainly are no exception to that. And people currently are traveling to places with the soon to be importation of drugs from Canada and people traveling across the border and things like that to get their drugs out of Canada. But realistically, that actually hasn't had too much of an impact on the US drug market, for instance. There's
right.
plenty of states that have introduced bills to the point now, there's no states that have actually signed off on those bills. Nothing's actually come out of it yet. And so it poses the idea, at least the belief, that things will change in the future. But as of right now, nothing sadly has changed too much. However, I think that as people are better aware of their options and the free market really does take freedom into its own hands, I think that medical tourism as a whole, I think that accessibility of healthcare is going to become not just a considerably more hot topic, but a considerably more economically impactful topic as well.
Yeah, I agree with that. And the reason I ask this, and it is an interesting topic for me, I have a friend who's involved with an organization that is focused on globalized telehealth medicine, which I can't imagine anything more complex just because of the different regulatory and legal landscapes on virtual care. But you're right. I mean, it's whether you have US citizen expats that are living in you name the country, they need they need primary care, and they can do
Yeah.
that virtually. Then what does that look like? And then how do you expand that to yeah, I'm in the US, but there's a provider in China or some other country that can provide the care that I need at a reasonable cost. And so it's interesting to me. I agree. I think it does look like that the healthcare market is becoming more globalized as prices are more transparency, there's more accessibility to these international markets. It's very interesting. And I'm always curious about and I'm interested in your thoughts on this. Adam, what does the competition from international providers mean for, let's just take the US healthcare system? And do you think that this pressure, this increased competition, this increased globalization of the healthcare market can actually drive cost or quality improvements domestically?
Well, it's
Well,
funny you mentioned
a
that.
loaded question. I know there may not be a great answer, but I'm curious of your thoughts on that.
Just this morning, I was writing a article in regards to some parties that are interested in investing in Sylk Health, talking about the future of the healthcare market and just how things will change. And not to dramatize it too much, but the American healthcare system really thrives in darkness and secrecy. And a good example of that being I believe it was 2021 was a law passed by Biden's administration regarding healthcare transparency. It was essentially a requirement of healthcare providers to publish just how much they charge for each and every individual procedure.
Right.
And since then, one in five, or 21% of hospitals actually comply with that law. The other 79%, they simply just don't publish what their prices are. And so, you come in with some kind of even emergency issue and, you want to know how much it is. Maybe you could possibly go to another hospital or something like that, but they just won't tell you. And by the time that they do tell you, you've already been treated and you're being handed a bill. So as it is currently, there's there's basically no price transparency, and that is, I would argue, certainly by design, at least as far as healthcare companies and providers are concerned, is because if you don't know, then you can't really do anything about it. And I'm sure, certainly in your practice, you've heard time and time again. I went to the hospital and I've got a $60,000 bill. I've got a $70,000 bill, whatever it might be. And that is essentially that secrecy that I'm talking about. People simply don't know what it costs before they have to get it. You call a plumber, he's going to give you a quote. You're going to even an ambulance ride, for instance, is a great one. You would think, well, an ambulance ride is an Uber Plus, and they've got maybe some medical equipment on board, but it can't be that much. And all of a sudden, your $30 Uber ride has turned into a $3,000 Uber ride.
Sure.
And so it's all really about disclosing and obfuscating prices before you pay or before you've actually used the service or treatment, whatever it might be. And by the time you have used it, oh, okay, here's your $100,000 bill or whatever it might be. And when it comes to what we're doing, I think that is perhaps the most important part is simply putting a price next to a treatment. And you might say, "Oh, that's an incredibly simple thing. That's elementary," and that is elementary. It's done almost everywhere around the world. You can look at Europe, you can look at Eastern Europe, you can look at Asia. You've got a treatment that you need, and you're going to be told a price right next to it. I can go through, for instance, we're talking to some hospitals in Russia recently, and I don't even have to, ring them up or get in contact with them. I can go to their website and I can see the price for each and every individual treatment and then the exceptions and different modifiers that they have. So they tell me what the prices are, but try doing the same thing in the US with some very few exceptions and you're not going to know at all. And so the only possible way to bring that about, as I'm sure most people realize when it comes to business, when it comes to anyone who's in the business of making money, the only real way to affect any change is to attack somebody's bottom line. And that's what we're here for, is to attack the US healthcare system's bottom line to the point where they're forced to change.
Interesting. Very interesting. Certainly, the bottom line is what gets a lot of reaction. So I
Yeah.
understand how that's your plan of action. I want to stay focused just quickly on the future of healthcare delivery. We've talked a little bit about how the trend of and maybe it's not even a trend, it just the trajectory of medical tourism is on the rise. What does healthcare look like in your view 10 years from now if this trajectory continues?
Well, I'll just talk about the US. And I won't even talk about healthcare to begin with. I think the most important thing to do is to look at wages and the relative amount of compensation that the average person receives. Prices go up and relative earnings are going down. And maybe I'm looking at this from too simple of a perspective, but if people are already having trouble affording healthcare and things are getting worse economically speaking, people are going to be using American healthcare even less in the future. If they're already avoiding doctors and treatments and things like that, as I mentioned before, then it's only going to get worse. And so, from my perspective, healthcare tourism, medical tourism, I wouldn't describe as a luxury or just for the savvy consumer anymore. I would say it's going to become a requirement to have a happy and healthy life.
Interesting. And what do you think healthcare leaders are underestimating about consumer behavior that's really going to feed that trend over the next 10 years?
Well, with all things, we kind of get stuck in our ways.
Right.
As much as the corporate world likes to pretend that they're agile, I'm sure that's a buzzword that gets thrown around at boardrooms, but they're not. If they were agile, then the healthcare issue for the consumer would have been fixed 15, 20 years ago. But by and large, these healthcare companies and providers are not agile at all. And so, from the perspective of a healthcare provider, I think it's going to be a matter of, yet again, just diminishing returns, diminishing profits up until some kind of realization takes hold and change is forced.
Yeah, interesting. So, Adam, this has been an incredibly interesting conversation. I appreciate your time and the fact that you're on the other side of the world right now. We've only had a couple of tech hiccups has been phenomenal. So I appreciate it. I know you're in a very different time zone than I am, so I appreciate
No
you
worries.
sacrificing and carving out some time for this discussion. I like to end every episode with a lightning round. Just want to ask you a few quick questions. Adam, you might be surprised by this, but I actually have a sponsor for this segment of of our podcast. So, our lightning round, as always, is brought to you and sponsored by Western Associates. It's a company that helps organizations create high quality branded merchandise and corporate products that people actually want to keep. If your organization is looking to elevate its brand through custom merchandise, you can contact them and learn more at westernassociates.com or contact Mike Eldridge at MELDRIDGE at westernassociates.com. Uh, I don't have as many YouTube viewers as I do on the podcast. So for podcast listeners, this isn't going to help you, but I am wearing one of their brand shirts with my logo on it. So great, high quality items. I'll also put a link in the episode description if you want to learn more. So, Adam, three quick questions for you. Number one,
The biggest reason prices in healthcare remain opaque.
Uh, it lets people make money. There's no other reason. It's all about money making.
One question every patient should ask before a procedure but doesn't.
Where's my patient advocate?
And finally, what are you reading now, show you are binging, or podcast you are listening to?
I just finished part 3 of the 1960s Soviet War and Peace. There's 4 parts to it. Amazing production. They went absolutely over the top with it. You know, like 15,000 troops in the battle scenes, all kinds of stuff. They raided the all of the museums in Soviet Russia just to find period accurate costumes and things like that.
Oh,
Amazing
wow.
production.
That's it for this episode of Health Law Pulse, and for me, it was a really fascinating one. I want to thank Adam for joining me to discuss this very interesting topic of pricing transparency in medical tourism. I really hope you enjoyed it. And thank you for tuning in to episode 8 of Health Law Pulse. If you enjoyed today's episode, subscribe, leave a review, share it with a friend. I would really appreciate it if you did that. We are on YouTube, Spotify, and Apple Podcasts. You can also find links to these episodes on my website at www.healthlawcouncil.com. We'll be back soon with more conversations at the intersection of healthcare, law, technology, and leadership. Take care.